enough.
Okay, we ready? Are we recording?
The branch of the nerve that Janet has irritated distally is the peroneal branch, which is more L5 distribution, whereas tibial nerve is more S1 and along the medial side. The typical protocol we have for long tract involves that other branch, involves the tibial branch, but her most involvement is in the peroneal branch right here. We can palpate it, plus her MRI already shows evidence of compression of S1 nerve root. So we want to palpate for the worst spot, realize that there's a deep branch to this nerve that comes anteriorly, L5 distribution pathognomonic for right in this area in the first interspace. There's also a superficial branch that comes here, but the superficial branch then courses over the dorsal foot. And why that's important is in doing long tract, the first thing we want to do is shorten the nerve to the spot of the worst entrapment. The worst one is up here, but we're going to start more distally. So we want to take a distal tension. First we want to shorten the nerve to this point. So the way we're going to do that is by dorsiflexing the foot. Then we want to stretch the nerve at the knee by extending the knee. We want to stretch the nerve at the hip by flexing the hip, and we want to stretch the nerve up here by flexing the head and trunk. Then what I'm going to do is take proximal tension on the nerve at that point, extend your head. We're going to get the relaxed side first. Stabilize our hip, please, Josh. Hold on to our pelvis. Then we're going to extend the hip, flex the knee, and then I'm going to plantar flex the foot to pull the nerve through. Then I'm going to take distal tension on that side, and we're going to dorsiflex the foot to relax, slight lateral rotation, and eversion. Then we're going to extend the knee to stretch it at the knee. We're going to flex the hip to stretch it at the hip. Wait. Now flex the head. Always do the flexion spot last. That area is very involved, as we could see. So we're going to go back and do that again because she liked it so much.
Is that
so
just for his stomach?
Extend.
Do you feel the whole
Extend.
track?
Extend the head.
Oh. Stabilize?
Slowly.
Yes, please. And so then the first thing I'm going to do is relax the nerve to here, stretch it at the knee, stretch it at the hip. Hold on. Okay, now the head and the trunk. Just pull your whole head forward. There you go. Good. Head backwards. Relax side first, stretch side last. And we're going to do one more spot. The worst spot here is in the proximal third of the peroneal muscles. The superficial peroneal nerve is entrapped right there. Good. Now we're going to go more proximally. The second entrapment is right below the fibular head, right here. So we're going to take proximal tension, head back. The difference between this and tibial nerve, in order to stretch the nerve when we get to here, we have to plantar flex the foot, which is different than if you're doing the tibial nerve. Then I will take distal tension on the nerve right where it comes around the fibular head. Dorsiflex the foot, extend the knee, flex the hip, and now the head. That one isn't as bad as the last one. Then we want to check the nerve around the fibular head. It's a little bit proximal to there where that's tight. So she's already extended her head, which is relaxed the nerve to there. Hold her hip.
Gee, get a taste of being an instructor, Josh.
So we're going to extend the knee. Good. Now, distal tension on the common peroneal nerve before it bifurcates. Dorsiflex the foot. Flex your knee, please. Flex your knee. There you go. And head forward. Good. Head backwards. It's not as bad right here. Extend your knee, please. Good. Flex your knee. Hold on. There we go. Now flex your head. Now the difference here, I'm using a peroneal nerve bias, so I'm plantar flexing the foot and dorsiflexing when I come into flexion, which is opposite the standard pattern that's on the video. But why we do it this way is her peroneal branch is the one that's scooped up. Straighten your knee. Good. Relax. Flex your knee and your hip. flex your head. Oops. Now flex your head. Good. Okay. Relax. Okay. Flex your head. Little boss. Relax. Don't do anything.
Frisco's double eagle.
Okay. Now.
Double eagle.
Good. Okay. That's good. I'm not done.
Oh, okay.
Good. No more video.
Okay.
Don't stay there.
Oh, stay there? Okay.
Good. Some more glute